When it comes to safety records, I suppose there's some kind of way of comparing surgeons, and I'm not sure if that's widely available, but do you know how your safety record compares with, say, the national average?
Yeah, so there are ways that we actually measure our outcomes, and we have defined criteria. So there's measuring in terms of treatment success, what percentage of our patients don't need to wear glasses, and certainly with these multifocal lens implants, 95% of my patients never wear glasses again. 5% of patients need occasionally a very weak pair of reading glasses for specific things like trying to read in bed at night with a very dim light. In terms of safety measures, we use measures of patients losing vision, and we also use something called the posterior capsular rupture rate. Now what that is when we do cataract surgery, we need to remove the natural lens from the ligament that holds it in place, leaving behind the ligament so that we can then put the plastic lens implant into that ligament to hold it in place. Occasionally, that ligament can be damaged, and it's a problem because it needs additional surgery to fix it, and the lens implant then needs to be put in a different position within the eye. So we very much need to avoid damaging this ligament, and damaging it is called a posterior capsular rupture. So surgeons compare themselves according to their posterior capsular rupture rate. The national average, if you look at all the surgeons in the UK, is somewhere around the 1% mark. Different studies have found different grades of surgeons. So certainly more junior surgeons who do fewer procedures can have up to a 10% rate, whereas very experienced surgeons who've done thousands of procedures tend to have a rate of about 1 in 1,000 or 0.1%.
It's a big range.
It is a big range, and But I think surgeons need to be really transparent about what their posterior capsular rupture rate is. My own personal rate is in the region of 0.1%, which is 1 in 1,000 operations. There's damage to this ligament. But again, another important part of that is it's not damaging the ligament is actually not the worst thing. The worst thing is then if you continue a sequence of events and do more damage or don't rescue the situation, then that leads to more problems in the longer run. So it's about how you deal with it that is actually the real critical thing. And again, experience comes in there.